When you're facing a serious health issue, maybe one with different treatment paths, trying to figure out the best way forward, well, it can feel overwhelming.
Absolutely. It's a lot to take in.
Today, we're diving deep into a really important study that looked at exactly this kind of situation. It compared two ways to fix a dangerous bulge in the main blood vessel in your belly, what's called an abdominal aortic aneurysm, or AAA. And this isn't just about the technical side of surgery. It's more about understanding the real-world impact these choices have on people's lives, both right away and years later.
That's right. And you shared some key sources about the OVER trial. That's the open versus endovascular repair study. It was a very thorough piece of research involving U.S. veterans looking closely at traditional open surgery versus the less invasive endovascular approach for these AAAs.
Right. So our goal here is really to unpack that. What are the crucial takeaways from this research for you, the listener?
Exactly. We want to get a clear picture of the short-term benefits, the longer-term outcomes, and maybe some surprising results that came out of the OVER trial when comparing these two methods.
And what makes this so useful is how long they followed these patients. I mean, later reports went out to, 14 years? That's quite a long view.
It really is. That long-term perspective is critical.
Okay, so let's start back at the beginning. When endovascular repair first emerged, there's a lot of excitement, right? The idea was, well, it's less invasive, so it's probably going to lead to better results overall.
That was definitely the hope. And you see that reflected in some expert commentary from the time. The expectation was, avoid the big open surgery, avoid that trauma, and you'd naturally get a clean advantage in outcomes.
Makes intuitive sense.
It does. But, the OVER trial was designed specifically to see if that initial optimism held up, especially when looking beyond the immediate recovery.
Okay, so let's get into the nuts and bolts. What exactly did the OVER trial involve? How was it structured?
So the OVER trial was what we call a randomized, multi-center clinical trial. Basically, a really well-designed study. They enrolled 881 veterans from 42 different VA medical centers.
Okay.
All these patients needed elective repair for an AAA, and importantly, they were considered suitable for either the open surgery or the endovascular approach.
So they could safely have either one.
Correct. Then they were randomly assigned, almost perfectly split, 444 to endovascular, 437 to open repair. That randomization is key to avoiding bias.
Right. Makes the comparison fair.
Yeah.
And the first results came out after how long?
The initial report, published after tracking patients recruited between 2002 and 2008, looked at how everyone was doing up to 2 years after their procedure.
Got it. So in those first 2 years, what did they find? Where did endovascular really shine?
Well, in the short term, endovascular showed some pretty clear advantages. The big one was perioperative mortality. That's the risk of dying within 30 days or during that first hospital stay. It was significantly lower in the endovascular group, only 0.5% compared to 3.0% for open surgery. That difference was statistically significant.
Wow. Okay, 0.5 versus 3%. That's a big difference right off the bat. What else?
And other things, too. The endovascular procedures themselves were generally quicker. Median time was about 2.9 hours versus 3.7 for open.
Okay.
And less blood loss. Median 200 milliliters compared to a full liter, 1,000 millil with open repair.
Which means fewer transfusions, I imagine.
Exactly. Lower transfusion requirement. Also, shorter time needing mechanical ventilation after surgery, if needed at all.
So faster recovery overall.
It certainly looked that way initially. Shorter hospital stays, median of 3 days for endovascular versus 7 days for open. And less time in the ICU, too, a median of 1 day versus 4 days.
So faster procedure, less blood loss, quicker recovery, lower immediate death rate. It sounds like a slam dunk for endovascular at that point.
It definitely painted a very positive picture for the immediate post-op period. There was, however, a trade-off, the authors noted.
Oh, what was that?
The endovascular procedure involves substantial exposure to fluoroscopy, that's the real-time X-ray imaging, and also contrast dye, which has its own potential issues for some patients.
Right, so not entirely without its own considerations, even if less surgically invasive.
Precisely.
Okay, so clear short-term wins on several fronts. But what about the bottom line question? Overall survival at the 2-year mark.
Yeah, this is where the picture gets a bit more nuanced. Despite that really significant reduction in perioperative deaths with endovascular,
Hmm.
the study found no statistically significant difference in overall mortality between the two groups at the 2-year point.
No difference, really.
Yeah, the rates were 7.0% in the endovascular group and 9.8% in the open repair group. But statistically, that difference wasn't significant in this trial.
Huh. So that early survival benefit just didn't carry through to the 2-year mark in terms of overall deaths.
It didn't translate into a significant difference in overall survival by then, no. The initial hope that it would lead to longer lives overall, well, it didn't quite pan out within those first 2 years.
That's a really key finding. What about other things? Complications? Quality of life?
Also very interesting. At that same 2-year check-in, the overall trial found no significant differences between the groups in major morbidity, so serious complications.
Okay.
Also, no difference in procedure failure rates, the need for secondary or follow-up procedures, hospital stays related to the aneurysm itself, health-related quality of life scores, or even erectile function.
So wait, aside from the initial death risk and that quicker immediate recovery, most other important things look pretty much the same after 2 years.
Broadly speaking, yes. Based on that 2-year data, the outcomes were surprisingly similar across many important measures.
Now, you mentioned expert commentary alongside the study. Did that add any extra perspective here?
It did. The commentary pointed out that these findings from OVER, this American trial, actually echoed what some European studies had found specifically, that early survival advantage for endovascular repair seemed to fade by about 2 years.
So it wasn't totally out of the blue.
Not entirely, but the commentary stressed how important OVER was because it was a large, well-designed U.S. study confirming this pattern in a different healthcare system and maybe a slightly different patient group.
Right, that makes sense. Okay, so 2 years, short-term benefits for endo, but similar medium-term outcomes.
Wow.
But you said they kept following these patients much longer.
Absolutely. And that's crucial because aneurysms and their repairs are a long-term issue. By 3 years, the investigators reported that trend continued, similar long-term survival overall, despite that initial perioperative advantage for endovascular.
And as more time passed, did any specific long-term issues become clearer?
Yes, one persistent concern was the risk of the aneurysm rupturing after endovascular repair, even years later. It wasn't common, but it remained a possibility. And there was an interesting finding mentioned in the commentary referencing a different 5-year report. It hinted that maybe, just maybe, endovascular repair offered better long-term survival specifically for younger patients, but perhaps not for older ones.
That's counterintuitive, isn't it? You'd think the less invasive option would benefit older, perhaps frailer patients more.
You might think so, yeah. It suggests the long-term durability might play out differently depending on age, but that was just a hint from other data. The main over-finding was still similar survival overall.
What about costs? Did the quicker recovery with endovascular make it cheaper in the long run?
Good question. They did a cost-effectiveness analysis later on. What it showed was, yes, initial costs were lower with endovascular, mainly shorter hospital stays. But over time, those savings tended to get eaten up by increased costs from needing more follow-up imaging, like CT scans, and crucially, more secondary procedures to deal with issues with the endovascular graft.
So fixing problems later on.
Exactly. So by 9 years out, there was actually no significant difference in the overall cost effectiveness between the two methods. The upfront savings didn't necessarily hold up long term.
Okay, that's important context.
Yeah.
Now, you mentioned the risk of rupture and needing secondary procedures after endovascular. What's driving that?
This really brings us to the issue of endoleaks. It's a key concept with endovascular repair.
Endoleaks.
Yeah. So the graft is like a sleeve placed inside the aneurysm to block blood flow into the bulge. But sometimes blood can still find ways to leak around or through the graft components and get back into the original aneurysm sac. That's an endoleak.
And that's common.
It's relatively common, yes. The concern is that these endoleaks, especially certain types, can repressurize the aneurysm sac and cause it to start growing again over time.
Which could lead to rupture eventually.
Potentially, yes. The study found that endoleaks were associated with aneurysm growth, specifically delayed type 2 endoleaks. These are leaks from small side branches feeding back into the sac, often appearing more than a year later, seemed particularly linked to aneurysm enlargement.
And do these leaks always need fixing?
Not always, but often enough. The over data showed about 32% of patients who developed an endoleak ended up needing some kind of secondary intervention to try and stop it. And interestingly, the initial size of the aneurysm was a predictor of whether someone might need that later fix.
So a key difference is that with endovascular, there's this ongoing need for surveillance and a higher chance you might need another procedure down the road.
That's a really crucial takeaway, yes. And the longest-term follow-up from over, out to 14 years, really solidified this.
What did the 14-year data show overall?
Well, first, it confirmed no significant difference in all-cause mortality. Survival was similar between the two groups, even after all that time. But it also definitively confirmed that the rate of needing those secondary therapeutic procedures was significantly higher in the endovascular group over that very long time frame.
So more trips back for fixes with the endovascular approach. Did that initial finding about lower post-op mortality in the U.S. trial hold up?
Yes, interestingly, the 14-year data still supported that observation. The immediate postoperative mortality was lower in this U.S.-based over trial compared to what some earlier European trials had reported for endovascular repair.
Now, the commentary made a point about patient preference. I imagine endovascular sounds a lot less scary to most people.
Oh, absolutely, and understandably so. The commentary highlights this: patients often prefer endovascular because it is less invasive surgically, recovery is typically faster, less painful initially, and that lower early death rate is very appealing.
It means getting back to normal life quicker.
Exactly. That's a powerful draw.
But it sounds like that initial preference, based on the short term, needs to be weighed against this longer-term reality.
That's precisely the point. Even with ongoing improvements in the endografts, the technology used, the fundamental finding from over holds. Long-term survival is similar to open repair, but the trade-off is that higher likelihood of needing more procedures later on with endovascular. That's a critical piece of information for informed consent.
So how has all this long-term data from over actually changed things in practice? How do doctors and patients make this decision now?
Well, these findings have definitely become a cornerstone of how clinicians discuss AAA treatment options. It underscores the need for lifelong surveillance after endovascular repair, regular imaging to watch for endoleaks or aneurysm growth.
Right, you can't just fix it and forget it.
Not with endovascular, no. It's about making sure patients really understand both sides, the upfront benefits, and the potential long-term commitments and risks, like late rupture or needing those reinterventions years later. It allows for a much more nuanced discussion.
Okay, so if we were to boil down this whole deep dive into the over trial, what's the single most important message for listeners?
I think the core message is this. Endovascular repair clearly offers significant short-term advantages, lower immediate risk, faster recovery. That's real. But when you look out over the long term, 10, 14 years, the overall survival seems to end up being very similar to traditional open surgery. And the price for those early benefits is a higher chance of needing more procedures later and the lifelong need for monitoring due to risks like endoleaks.
So it's a trade-off, really.
It is. It's a complex trade-off that needs careful consideration by both the patient and their doctor, factoring in age, health, anatomy, and personal preferences about risk and recovery.
It really makes you think, doesn't it?
Yeah.
Given how appealing less invasive options are and those definite early wins for endovascular repair, how should we, patients and doctors, really weigh those immediate pluses against the long-term picture, the similar survival, and that potential need for more interventions down the line compared to open surgery? And, what role might newer technologies play in shifting that balance in the future? Definitely something to chew on.